Measles is a highly contagious viral disease that can cause serious complications, especially in young children. In recent years, measles outbreaks have increased in several countries due to factors such as declining vaccination rates, misinformation about vaccines, and gaps in healthcare access. Understanding why measles is becoming a growing threat is essential to protecting children's health and preventing future outbreaks. Greetings and welcome to Wellness Bites Studio. I am Dr. William Lee. In today's video, we will take an in-depth look at measles, a preventable yet potentially serious illness that has seen a concerning rise in recent years. Understanding the causes, symptoms, risks, and prevention strategies is essential for safeguarding children's health. Let's get started. Symptoms usually appear about 7 to 14 days after exposure and often develop in stages. There are some symptoms of measles. The first symptom is high fever. High fever is one of the most important and recognizable symptoms of measles, a highly contagious viral disease caused by the measles virus. In many cases, fever is the first sign that appears before the characteristic rash develops. After exposure to the virus, symptoms usually begin after an incubation period of about 7 to 14 days. The illness often starts with a rising fever, cough, runny nose, and red, watery eyes. As the infection progresses, the fever becomes increasingly severe and may reach 104 degrees Fahrenheit, 40 degrees Celsius, or even 105 degrees Fahrenheit, 40.6 degrees Celsius, in some patients. When the typical measles rash appears, the fever often reaches its highest level. The high fever associated with measles occurs because the body's immune system is actively fighting the virus. When the virus enters the body, it infects cells of the respiratory tract and spreads through the bloodstream. The immune system responds by releasing various inflammatory substances known as cytokines. These chemicals act on the brain's temperature-regulating center, causing body temperature to rise. Fever is therefore not merely a symptom, but also a sign that the body is mounting a defense against infection. However, in measles, the immune response is particularly intense, which explains why the fever can become very high compared with many other common viral illnesses. The fever often begins gradually and increases over several days. During the early stage of illness, individuals may experience tiredness, irritability, loss of appetite, headache, and a general feeling of being unwell. As the temperature rises, patients may develop chills, sweating, muscle aches, and weakness. Young children may become unusually fussy or lethargic. Because measles fever can remain high for several days, it places considerable stress on the body and increases the risk of dehydration, especially in children who are not drinking enough fluids. One of the classic features of measles is the sequence of symptoms. The illness generally begins with fever and the 3 C's: cough, coryza, runny nose, and conjunctivitis, red eyes. Small white spots known as Koplik spots may appear inside the mouth a few days later. After several days of fever, the characteristic red rash develops, usually starting at the hairline and spreading downward over the face, neck, trunk, arms, and legs. At the same time, the fever often spikes to its highest point, sometimes exceeding 104 degrees Fahrenheit. High fever in measles is clinically significant because it can indicate the severity of the infection. Although many patients recover completely, prolonged high temperatures can lead to complications. Children may experience febrile seizures, which are convulsions triggered by fever. While many febrile seizures do not cause long-term harm, they can be frightening for families and may require medical evaluation. High fever can also contribute to dehydration due to increased fluid loss through sweating and reduced fluid intake caused by discomfort or sore throat. The fever of measles differs from the mild fever seen in some other viral diseases. For example, rubella, sometimes called German measles, usually causes a low-grade fever, whereas measles frequently produces a much higher temperature. This distinction can help healthcare professionals recognize the disease during clinical assessment. The combination of very high fever, cough, runny nose, red eyes, and a spreading rash strongly suggests measles, particularly in unvaccinated individuals or during outbreaks. The duration of fever in measles varies. Typically, the fever begins several days before the rash and remains elevated as the rash spreads. In uncomplicated cases, the temperature gradually decreases after a few days of rash appearance. As recovery begins, the patient often feels more energetic, appetite improves, and respiratory symptoms start to resolve. However, if the fever persists or returns after initially improving, healthcare providers may suspect a secondary bacterial infection or another complication. Complications associated with measles can make high fever even more dangerous. Pneumonia is one of the most common serious complications and a major cause of measles-related deaths worldwide. Ear infections, diarrhea, and inflammation of the brain, encephalitis, may also occur. In cases of encephalitis, high fever may be accompanied by severe headache, confusion, seizures, or changes in consciousness. Such symptoms require urgent medical attention because they can indicate a life-threatening condition. Children under 5 years of age, adults over 20 years of age, pregnant women, and individuals with weakened immune systems are particularly vulnerable to severe disease. In these groups, high fever may be more difficult to manage and may signal an increased risk of complications. Malnourished children, especially those with vitamin A deficiency, are also more likely to experience severe measles. For this reason, health organizations recommend vitamin A supplementation for children with acute measles in many settings because it can reduce complications and improve outcomes. Management of high fever in measles is primarily supportive because there is no specific antiviral cure for routine measles infection. Adequate hydration is essential. Patients should drink plenty of fluids such as water, oral rehydration solutions, soups, or other suitable beverages. Rest is important to allow the body to recover. Healthcare providers may recommend fever-reducing medications such as acetaminophen, paracetamol, or ibuprofen when appropriate. Aspirin should generally be avoided in children because of the risk of Reye syndrome. Caregivers should follow medical advice regarding medication dosage and use. Monitoring is another important aspect of managing measles-related fever. Parents and caregivers should watch for warning signs such as difficulty breathing, severe dehydration, persistent vomiting, seizures, extreme drowsiness, confusion, or fever that remains very high despite treatment. Medical evaluation is recommended if any of these symptoms occur. Early recognition of complications can improve outcomes and reduce the risk of severe illness. The contagious nature of measles means that a person with high fever and other symptoms can spread the virus to others even before the rash appears. Individuals with measles are generally contagious from about 4 days before the rash develops until 4 days afterward. Because the fever often starts before the rash, infected people may unknowingly transmit the virus while believing they have a common cold or flu-like illness. In summary, high fever is a hallmark symptom of measles and often appears early in the course of infection. It commonly rises above 104 degrees Fahrenheit and may peak when the characteristic rash develops. The fever results from the body's immune response to the measles virus and is frequently accompanied by cough, runny nose, red eyes, fatigue, and later a widespread rash. While fever itself is part of the body's defense mechanism, it can lead to dehydration, febrile seizures, and other complications, especially in vulnerable populations. Careful monitoring, adequate hydration, supportive treatment, and prompt medical attention when warning signs occur are essential for safe recovery. Most importantly, vaccination remains the most effective way to prevent measles and the severe high fever that often accompanies this disease. The second symptom is cough. Cough is one of the classic and most recognizable symptoms of measles, a highly contagious viral disease caused by the measles virus. Along with fever, runny nose, coryza, and conjunctivitis, red, watery eyes, cough forms part of the characteristic group of early symptoms that appear before the well-known measles rash develops. The cough associated with measles is typically persistent, dry, irritating, and often severe enough to cause discomfort, sleep disturbance, fatigue, and difficulty carrying out daily activities. Understanding why cough occurs in measles requires an understanding of how the virus infects the body and affects the respiratory system. After a person inhales droplets containing the measles virus, the virus initially infects cells lining the respiratory tract and then spreads throughout the body via the bloodstream and lymphatic system. During this process, the respiratory passages become inflamed, leading to irritation of the throat, larynx, trachea, and bronchi. This inflammation stimulates cough receptors located throughout the airways, resulting in the persistent coughing that is commonly observed in infected individuals. The cough usually begins during the prodromal phase of measles, which occurs several days before the rash appears. During this stage, patients often develop high fever, malaise, loss of appetite, nasal congestion, and conjunctivitis. The cough may start as mild throat irritation but gradually becomes more frequent and troublesome as the infection progresses. In many cases, the cough worsens at night because mucus accumulation and airway irritation become more noticeable when the patient is lying down. The measles virus damages the protective lining of the respiratory tract, reducing its ability to clear mucus and pathogens effectively. As a result, coughing serves as a protective reflex intended to remove secretions, debris, and infectious particles from the airways. However, because the viral infection causes widespread inflammation, the cough may continue even when little mucus is present, making it predominantly dry in nature. The severity of cough varies from person to person depending on age, immune status, nutritional condition, vaccination history, and the presence of underlying respiratory diseases. Young children often experience more severe coughing episodes because their airways are smaller and more susceptible to obstruction and irritation. In some cases, repeated coughing can cause chest discomfort, sore throat, headaches, abdominal muscle pain, and exhaustion. The cough may become so intense that it interferes with eating, drinking, and sleeping, contributing to dehydration and weakness. One important feature of the cough in measles is its association with the 3 C's of measles: cough, coryza, and conjunctivitis. These symptoms usually appear together and provide important diagnostic clues for healthcare professionals. The cough often persists throughout the acute phase of the disease and may continue for several weeks after the rash has faded due to lingering airway inflammation and gradual recovery of the respiratory lining. The immune response plays a significant role in the development of cough during measles. When the body recognizes the invading virus, immune cells release inflammatory chemicals known as cytokines. These substances help fight infection, but also contribute to swelling, redness, mucus production, and increased sensitivity of cough receptors. Consequently, the body's efforts to eliminate the virus can unintentionally intensify respiratory symptoms. In addition to direct viral effects, cough in measles can be worsened by secondary bacterial infections. The measles virus is extraordinarily contagious and can remain infectious in the air or on surfaces for up to 2 hours under certain conditions. This means that a single coughing individual can infect many susceptible people in the surrounding environment. In fact, measles is considered one of the most contagious infectious diseases known. Because of this high transmissibility, individuals with measles are advised to isolate themselves and avoid contact with others until they are no longer infectious. Vaccination remains the most effective method of preventing measles and its associated symptoms, including cough. Its presence reflects the complex interaction between viral infection, airway inflammation, and immune response. Healthcare providers consider the timing, severity, and progression of cough when evaluating patients suspected of having measles. Early recognition of cough in combination with fever, conjunctivitis, coryza, Koplik spots, and rash can facilitate prompt diagnosis, isolation, and supportive care. Furthermore, awareness of warning signs such as worsening cough, breathing difficulties, persistent high fever, or signs of pneumonia is essential for preventing serious outcomes. In conclusion, cough is a hallmark symptom of measles that develops early in the course of infection and results primarily from viral-induced inflammation of the respiratory tract. It is usually dry, persistent, and accompanied by other classic symptoms such as fever, runny nose, and red eyes. Although often self-limiting, the cough can cause significant discomfort and may become more severe if complications such as pneumonia occur. The symptom also plays a major role in spreading the virus from person to person, making it an important focus of both clinical management and public health prevention efforts. Through vaccination, supportive care, early recognition, and appropriate medical monitoring, the burden of cough and other measles-related symptoms can be significantly reduced, helping protect both individual patients and the wider community from this highly contagious disease. The third symptom is runny nose. A runny nose, medically known as rhinorrhea, is one of the classic and early symptoms associated with measles, a highly contagious viral disease caused by the measles virus. In the context of measles, a runny nose is not simply an isolated nasal symptom, but forms part of a characteristic group of early clinical features often referred to as the 3 C's: cough, coryza, runny nose, and conjunctivitis, red watery eyes. Coryza is a medical term that describes inflammation of the mucous membranes of the nose, leading to excessive mucus production, nasal congestion, sneezing, and continuous nasal discharge. During the initial stage of measles, known as the prodromal phase, the virus infects and multiplies within the respiratory tract and immune cells, causing widespread inflammation. As a result, the lining of the nasal passages becomes irritated and swollen, stimulating mucus glands to produce large amounts of secretions. This process leads to the runny nose that many patients experience before the appearance of the characteristic measles rash. The nasal discharge may begin as a clear, watery fluid but can become thicker as the illness progresses. Because measles primarily enters and spreads through the respiratory system, symptoms affecting the nose and upper airways are among the earliest manifestations of infection. The runny nose often develops alongside fever, malaise, fatigue, cough, and eye irritation, creating a picture that may initially resemble a common cold or influenza-like illness. This similarity can make early diagnosis challenging, particularly in areas where measles is uncommon due to successful vaccination programs. However, unlike an ordinary cold, the symptoms of measles tend to become progressively more severe. The runny nose in measles is frequently persistent and accompanied by significant nasal congestion, making breathing through the nose difficult, especially for young children. The inflammation affecting the nasal passages is part of a broader systemic response caused by viral replication and immune activation throughout the body. As immune cells release inflammatory mediators to combat the virus, blood vessels in the nasal mucosa become dilated and permeable, allowing fluid to leak into surrounding tissues and increasing mucus production. In children, the runny nose associated with measles can be particularly troublesome. Young children may experience difficulty feeding due to nasal obstruction, disturbed sleep, irritability, and discomfort. Excessive nasal secretions can also contribute to skin irritation around the nostrils and upper lip, leading to redness and soreness. Caregivers often notice frequent wiping of the nose, crusting of secretions, and noisy breathing caused by congestion. Although the runny nose itself is usually not dangerous, it reflects the underlying viral infection that can potentially lead to serious complications. Measles weakens the immune system and increases susceptibility to secondary bacterial infections, including sinusitis, otitis media, middle ear infection, and pneumonia. Persistent or worsening nasal symptoms may sometimes indicate the development of such complications. The pathophysiology of a runny nose in measles involves a complex interaction between viral invasion and host immune responses. After entering the body through the respiratory tract, the measles virus infects epithelial cells and immune cells, spreading to local lymphoid tissues and eventually throughout the body. During this process, the virus damages respiratory tissues and triggers inflammation. Cytokines and other immune mediators released in response to infection stimulate mucus-producing glands and increase blood flow to the nasal mucosa. The resulting excess mucus serves as part of the body's defense mechanism, helping trap pathogens and debris. A patient presenting with fever, cough, conjunctivitis, and a runny nose followed by a descending maculopapular rash raises strong suspicion for measles. Another important diagnostic clue is the presence of Koplik spots, which are small bluish-white lesions on the inner lining of the cheeks that appear before the rash. The runny nose often precedes these more recognizable signs, making it an important early symptom. In regions where measles remains endemic or during outbreaks, awareness of nasal symptoms can contribute to earlier case detection and implementation of infection control measures. From a public health perspective, understanding the role of respiratory symptoms such as a runny nose is essential because measles remains one of the most contagious infectious diseases known. A single infected person can transmit the virus to a large number of susceptible individuals. The virus can remain suspended in the air or survive on surfaces for a period of time, allowing transmission even after the infected individual has left the area. Last symptom is red, watery eyes. Red, watery eyes are one of the classic and highly recognizable symptoms of measles, a contagious viral disease caused by the measles virus. This eye-related symptom, medically referred to as conjunctivitis, occurs when the thin membrane covering the white part of the eyes and the inner surface of the eyelids becomes inflamed as a result of the viral infection. In individuals with measles, the eyes often appear noticeably red, irritated, and excessively watery, giving the person a tired, uncomfortable, and sometimes distressed appearance. The redness develops because the small blood vessels in the conjunctiva become dilated and inflamed during the body's immune response to the virus. At the same time, the eyes produce an increased amount of tears, leading to persistent watering. This symptom frequently appears during the early stages of the illness, often accompanying other characteristic signs such as high fever, cough, runny nose, and malaise. Together, these symptoms form the well-known prodromal phase of measles, which generally occurs several days before the appearance of the distinctive skin rash. The presence of red, watery eyes can therefore serve as an important clinical clue for healthcare professionals when evaluating a patient who may have measles. The inflammation affecting the eyes is not merely a local reaction, but reflects the widespread impact of the virus throughout the body. After entering the respiratory tract, the measles virus multiplies and spreads through the bloodstream to various tissues, including the conjunctiva and other mucous membranes. As viral replication and immune activation continue, inflammation increases, resulting in redness, sensitivity, and tearing. Many patients with measles also develop photophobia, which is an increased sensitivity to light. Bright light may become uncomfortable or even painful, causing affected individuals to squint, close their eyes, or seek darker environments. This light sensitivity further contributes to the discomfort associated with the red and watery appearance of the eyes. In children, who represent a large proportion of measles cases worldwide, eye symptoms can be particularly noticeable. Parents may observe that their child's eyes look bloodshot, shiny with tears, and unusually sensitive. The child may rub their eyes frequently, complain of discomfort, or avoid looking at bright lights. These symptoms can sometimes be mistaken for common viral conjunctivitis or allergies, especially before the measles rash develops. However, when red, watery eyes occur alongside fever, cough, and a runny nose, healthcare providers often consider measles as a possible diagnosis, particularly in areas experiencing outbreaks or among individuals who have not been vaccinated. The eye manifestations of measles are important not only because they help identify the disease, but also because they reflect the potential for more serious ocular complications. While most cases of conjunctivitis associated with measles resolve without permanent damage, severe infections can sometimes lead to additional eye problems. In populations with poor nutrition, especially vitamin A deficiency, measles can significantly increase the risk of eye complications. Vitamin A plays a critical role in maintaining the health of the cornea and other eye structures. When vitamin A levels are inadequate, the inflammation caused by measles may become more severe, increasing the risk of corneal ulcers, keratitis, and even blindness. This is one reason why vitamin A supplementation is commonly recommended for children diagnosed with measles in many healthcare settings. Research has shown that vitamin A can reduce the severity of measles and lower the risk of complications, including those affecting vision. The watery nature of the eyes during measles is primarily a result of irritation and inflammation. Tears are produced by the lacrimal glands as a protective response to help flush irritants and maintain moisture on the surface of the eye. During measles infection, inflammatory mediators released by the immune system stimulate tear production, leading to excessive watering. Although this tearing may provide some protection, it can also cause discomfort and interfere with daily activities. Some patients report blurred vision due to the constant presence of tears on the eye surface. Others may experience crusting around the eyelids, particularly after sleeping, although this is generally less severe than in bacterial eye infections. The redness and watering typically persist for several days and often improve as the overall illness begins to resolve. Nevertheless, in severe cases or in individuals with weakened immune systems, eye symptoms may last longer and require medical attention. The historical significance of red, watery eyes in measles diagnosis should not be overlooked. Before the widespread availability of laboratory testing, physicians relied heavily on clinical observations to identify infectious diseases. The red, watery eyes represented by conjunctivitis are therefore a fundamental component of the classic disease presentation. Understanding why this symptom occurs requires an appreciation of the body's immune response. When the measles virus infects tissues, immune cells release various chemical signals, including cytokines and inflammatory mediators. These substances help fight the infection, but also contribute to tissue inflammation and irritation. In the eyes, this inflammatory process causes blood vessels to expand, increasing blood flow and creating the visible redness characteristic of conjunctivitis. Antibiotics are not effective against the measles virus, though they may be used if a secondary bacterial infection develops. Education about the significance of eye symptoms is also important. Families should understand that red, watery eyes in a person with fever and respiratory symptoms may indicate a contagious illness requiring medical evaluation. This awareness can contribute to earlier diagnosis and appropriate public health measures. At the end, we have to know how we can control measles. Preventing measles in children is essential because the disease is highly contagious and can lead to serious complications, including pneumonia, encephalitis, brain inflammation, vision problems, and even death. The most effective way to protect children from measles is through vaccination. The measles vaccine is usually given as part of the MMR vaccine, which protects against measles, mumps, and rubella. Children typically receive 2 doses, the first at 12 to 15 months of age, and the second at 4 to 6 years of age. 2 doses provide excellent protection and help prevent outbreaks in communities. Good hygiene practices also help reduce the spread of measles. Children should be taught to wash their hands regularly with soap and water, cover their mouth and nose when coughing or sneezing, and avoid sharing personal items such as towels, cups, or utensils with sick individuals. Since measles spreads through respiratory droplets and can remain in the air for some time, children should avoid close contact with infected persons whenever possible. Proper nutrition strengthens the immune system and helps children fight infections. A balanced diet rich in fruits, vegetables, proteins, and essential vitamins, especially vitamin A, supports healthy growth and immune function. Vitamin A is particularly important because deficiency can increase the severity of measles and the risk of eye complications. Parents should also ensure that children receive regular health checkups and follow the recommended immunization schedule. During a measles outbreak, unvaccinated children may need to stay away from schools or crowded places to reduce their risk of exposure. If a child develops symptoms such as high fever, cough, runny nose, red watery eyes, and a rash, medical attention should be sought promptly, and the child should be kept away from others to prevent transmission.